Hello, GOLD participants from around the world. I'm Fleur Bickford, Program Director and MC for GOLD Lactation Online Conference. I'm chatting today with Valerie Lavigne about her upcoming presentation titled Neuromusculoskeletal Disorders in the Breastfed Baby, Causes, Assessment, and Treatment. Valerie, thank you so much for being with us today.
Thank you for inviting me.
So, what we like to do with these interviews is just try to give our delegates a little bit of a sneak peek into what's coming up. But before we talk about your presentation, maybe you can just tell us a little bit about yourself and your professional journey. How did you get into, well, first chiropractic and then becoming an IBCLC?
Well, it's pretty simple. In my family, we've always gone to chiropractors, so I was exposed at a quite young age to the benefits of chiropractic. So I started going when I was young, and I think at the age of 14, we had switched to a lady chiropractor, and it was the first time that I noticed that I could actually, that was one of the possibilities for my profession. I was always interested in the health field, and I wanted to help people, especially by touch, so that was sort of the first introduction to what a woman could be a chiropractor as well, because it was always basically male-dominated before. Following that, so I graduated at the age of 24 from CMCC Chiropractic College in Ontario, and opened my practice. And I've always had the urge to have a family practice, but started slowly treating normal chiropractic issues, headache, neck pain, back pain, until my kids came into my life. And basically, I had Audrey. I was now almost 15. And I had nursing issues, and I met a lactation consultant. That was my first exposure to an IBCLC. We resolved the nursing issue. I nursed for a long time, and that really interested me into the clinical side of lactation. And then I saw the link between the two professions of how important it is to treat babies with musculoskeletal disorders, and basically became an IBCLC following that after the birth of my twins as well.
Okay, thank you. It's always interesting to hear, how colleagues come into this profession, and it's interesting how many of us have been, influenced by the struggles that we had with our own children. So that's fascinating. Now, one question I have for you is, what sort of changes have you seen during your career? The use of chiropractics in treating issues with breastfed babies is, it's more of a newer approach, I think. But I'm wondering what your perspective is as a chiropractor in IBCLC. What is kind of the biggest change that you've seen over the past few years with your career?
For sure, when I started seeing the link between the two professions and the importance of musculoskeletal issues in breastfed babies and how we could have an impact, I started noticing that not a lot of people realize that chiropractors could treat babies. A lot of people have a lot of myths surrounding our profession, that we only do adjustment with noise, that we can't treat with light touch, and how would you treat a small baby like that? But I started researching more and realized there was a bit of research out there, and started lecturing some of the lactation consultants in my area about the importance, and they started referring, and then I think the education got out and more, and now obviously I think it is a very hot topic and an important topic that needs to be addressed to be able to effectively breastfeed properly for the babies. So I think it's just over the last 14 years I've seen, from doing small groups to now actually being on the web, people are talking about musculoskeletal issues and having the importance of that being treated. So I think that's the biggest change I've seen in the last few years.
Okay, wonderful. Thank you. So perhaps now you can just give us a little bit of a sneak peek into your presentation and tell us a little bit about what you'll be touching on and what you hope the delegates will be able to take away from your presentation.
Sure. I think I'm a very hands-on kind of person. I like the presentation to be hands-on for people as well listening. So I give some great tools and some charts and some easy points. So when you're examining a baby or you're doing a treatment, you're not doing a treatment, but you're actually looking at a baby as an IBCLC, you'll be able to maybe spot the ones that really need care more easily. I think I demystify some of the issues as well, so you can look through your history and say, oh, you got a lot of red flags here. Maybe this baby needs musculoskeletal care. So I think this is one of the advantage of this presentation is really to give you tools to be able to identify in your practice babies that could use care or not.
Okay, thank you. Certainly looking forward to learning more. For our delegates who are listening, you can check out more from Dr. Valerie Lavigne and her presentation titled Neuromusculoskeletal Disorders in the Breastfed Baby, Causes, Assessment, and Treatment as part of our Bodywork Add-on packages. So thank you so much everyone for joining us and have a wonderful day.